A urinary tract infection, also called a UTI, is an infection that occurs in the urinary system. This could include the urethra, bladder, ureters, and kidneys. Most infections involving the bladder and urethra are known as the lower urinary tract infections.
The most common symptoms include painful urination, tenderness above the bladder area, urgency, and frequency of urination. Women are at greater risk for a UTI because the urethra is shorter than in men, so it's easier for bacteria to travel to the bladder. UTIs also are more common in postmenopausal women because low estrogen levels change vaginal and urethral tissue to increase the risk of infection. It's always better to prevent an infection rather than simply treat it. UTIs are no different. Follow these tips to lower your risk of a UTI with little or no potential negative side effects. 1. Drink plenty of fluids, especially water. This helps keep bladder tissue hydrated and healthy. It also dilutes your urine and lowers the concentration of bacteria in the bladder. Some people can clear an infection on their own just by drinking fluids. Try drinking at least 50 ounces, or about 1.5 liters, of fluid daily to prevent infections. 2. Empty your bladder often. Regularly emptying your bladder ensures urine is not sitting in your bladder for long periods of time. Since bacteria like warm and wet environments to grow, this takes away good living conditions for the bacteria. It's normal to empty your bladder 4 to 8 times per day. 3. Urinate soon after sex. The act of intercourse can cause bacteria to get close to or into the urethra, the small tube that empties your bladder. Voiding after intercourse removes some of the bacteria before it can cause an infection. 4. Take cranberry supplements. Cranberries contain a substance that can prevent bacteria from sticking on the walls of the bladder. This may help reduce bladder and other urinary tract infections (UTIs). Cranberries, usually as cranberry juice, have been used to try and treat UTIs, particularly in high-risk groups such as older people. 5. Wipe front to back. Doing so after urinating and after a bowel movement helps prevent bacteria in the anal region from spreading to the vagina and urethra. If you have 2 or more infections in 6 months, consider talking with your healthcare team about recurrent UTIs. Your healthcare team will review your medical history and medications and complete a thorough physical exam. Thanks for watching. Please like, subscribe, and share for more.